Hi, I'm Evey Schweig, and I'm here talking today with Mary Ellen Zung, Certified Holistic Health Coach. Mary Ellen started her health coaching practice in 2013 after working for most of her career in human resources for a large service company, and then in sales, client services, and operations in the corporate childcare industry. She has a bachelor's degree in psychology, a teaching certificate, and trained with the Institute for Integrative Nutrition to become a certified health coach. She's a member of the American Association of Drugless Practitioners, the International Association of Health Coaches, and the Natural Life Business Partnership. Welcome, Mary Ellen.
Thank you for having me.
It is my pleasure. It's great to have you here today. So let's start from the beginning. Exactly what is a health coach, and how would you describe what you do?
Great way to begin. So, well, in short, a health coach is a supportive mentor and wellness authority, helping clients feel their best through food and lifestyle changes. Each client is unique, and so each wellness program is tailored to meet the client's needs. So just like a sports coach or a career coach, I help train, guide, educate, encourage, support, and hold accountable. So I like to say I'm a guide on the side. And I not only work with individuals, but I also conduct health and wellness workshops in workplaces and in the community, such as libraries, fitness centers. And I also provide group programs and teach a 26-week diabetes prevention program for people with pre-diabetes.
Wow, it sounds like you do a lot of different things.
Yeah.
That's great. So I understand why someone might need a health coach for if they want to improve their health. But don't people generally go to a doctor for this?
Sure. Yes. People generally go to a doctor when they don't feel well.
Mm-hmm.
They have symptoms that are not normal or they're injured. And of course, there's a place for medical doctors. But much of what we go to a doctor for in this country is illness caused by lifestyle. We're stressed or pressed for time. We don't eat right. We eat fast food because we don't take time to cook. And processed foods can be a root cause of some brain issues, gut issues, skin issues, overweight, fatigue. We see depression and anxiety on the rise, and people self-medicating with food or alcohol or sleeping pills. Sleep is a big issue too. I deal with my clients with overweight, which can cause more health problems like high blood pressure, diabetes, and certain cancers too. There's a term, diabesity, now that's used to describe like a whole continuum of health problems ranging from insulin resistance and overweight to obesity or diabetes. And diabetes is the underlying cause of most heart disease and cancer and premature death. And, it's such a shame because these conditions are, 100% preventable and reversible. And, doctors give us a pill or tell us to lose weight or reduce our stress, but they don't have the time or the resources to help us do this to alleviate the problems. So that's where a health coach comes in.
Wow, right. So I understand now how a health coach might be different than a doctor, but there's other professions such as a nutritionist or dietitians. How does a health coach different from these professions?
Yeah, good question. The term nutritionist really isn't regulated, so technically anyone can call himself or herself a nutritionist, even with no formal training or license or certification. A dietitian, specifically a registered dietitian, is, that would be like an RD after one's name or an RND for a registered dietitian nutritionist. The terms are used interchangeably. This has specific meaning. So a nutritionist or registered dietitian is someone who can help you with a diet and calculate the macronutrients of foods you might need or need to avoid based on certain goals or illness or food allergy. And a health coach might do this also, but also includes, not just diet and nutrition, but overall wellness. So including things like physical activity, sleep, as I mentioned, stress, as I mentioned, but relationships too, and anything else that's causing unbalance in wellness.
Got it. So you mentioned that a person comes to you who's not feeling well, but what kind of person, from your experience, might do well working with a health coach?
Mm. Well, my most successful clients are those who really take responsibility for a lifestyle change, and they're open-minded to trying new things, and they do their homework. Um, I know change is very hard, and not all clients are ready to make change. So I help them with this by starting with where they are and taking small actionable steps. And if they're challenged or they're not able to make a change, we look at what's holding them back or getting in their way and try to address those things, which can be tough. People need a lot of support to make change. And I ensure that I can support them by listening very closely, not only to what they're saying, but what they're not saying, and taking good notes and
Mm-hmm.
using each session to follow up with the action steps from the last session.
Interesting. So you're talking about these sessions. Um,
Mm.
what can a client typically expect in a session, and maybe give us an idea of how long a program might last.
Right. Well, I have a 6-month program, but I just recently changed my program sessions. My other phone is ringing. My program sessions to include 3 sessions, 6 sessions, or 12 sessions. Generally, a 12-session, 6-month program is a good amount of time to make important lifestyle changes with some consistency.
Mm.
But sometimes, a client might really need help and they can't commit to a 6-month program or a 12-session program. So just getting them started out and making some really, substantial initial changes is what, a lot of people need. And then, they might continue as well. So a typical session is about an hour. And I meet with clients every 2 weeks in a safe space, either in their home, if they're local, or on the phone, or by Skype or Zoom, online. I've had clients all over the country, and we generally start out with a centering activity, just like, like taking some deep breaths and relaxing in our chair. Then I ask them what's new and good. I always want to start off with positive, and I encourage the good. And, sometimes people can't come up with their positives. So this forces the positive to come up before we get into the challenges. So we talk about those. And also I go back to the action items from the last session and ask them about the handouts that I sent to see if they had any questions or what they got from the information.
Mm.
I can also then tell if they're reading the handouts. So. And then, with some guidance, the client comes up with a few actions that they'd like to try before next session. And after the session, I send them a full set of notes and other handouts or items that I think might help support their changes or their education.
Mm-hmm. Wonderful. Wow. It sounds like you're very involved and supported with your clients.
I try.
Yeah, you must really get to know them pretty well, I would think.
Yes,
So,
it's true. Yeah.
yeah, how do you maintain a coaching relationship working with someone for what sounds like might be an extended period of time?
Yeah. Mm-hmm. Yeah, I do know quite a lot about the client. Often I know more than, their closest friend or their spouse. So professionalism, confidentiality, respect, and no judgment are absolutes for me.
Hmm.
And the hardest part is when the coaching program is over, because we feel close and have been in each other's lives. But it's also a great feeling because the client feels ready to be on their own, and they can always reach out to me. I have a newsletter that helps them keep in touch with what I'm up to, so they feel connected. And I also have a touchback program, like a one-off session. So if a client hasn't seen me in a year and they're going through some kind of life changes and they just need some support, they can just contact me for one session.
Hmm.
Yeah.
So how would you describe yourself? Like, how would you describe your coaching style, for instance?
Yeah, that's a good question. Very important. I believe that I'm compassionate and non-judgmental, a good listener, encouraging, friendly, but I also have to make the client understand boundaries such as holding himself or herself accountable for keeping appointments and following up with the action items. And also during the coaching sessions for, really looking at any blocks or what's holding them back and just being honest.
Right. Maybe could you tell us about some successes that you've had with a client?
Sure. One very clear case was a woman who came to me and said her doctor wanted to put her on cholesterol lowering drugs, but she asked her doctor to wait 3 months and check her again. She wanted to make some changes. So we worked together for 3 months to change her diet, her exercise, her stress, and her sleep. And after 3 months, she went for a checkup with her doctor, and her doctor was amazed. And she asked, "What did you do?" And my client told her she was, so impressed. She didn't, prescribe drugs, and she sent her on her way and told her to keep up the good work. So
Wow.
that was very satisfying. And I've had lots of other clients reverse conditions for which they were taking prescription drugs. And these are by far the most satisfying for me.
Wow.
Yeah.
Yeah, it sounds like it really, really is
Yeah.
satisfying.
Yeah. I just had
Wow.
someone the other day email me and said, my doctor no longer said I have prediabetes. So
Wow.
that's really awesome. Yeah.
That's fabulous.
Yeah.
You're making such a difference in their lives. Amazing.
Yeah. Yeah. So it's great.
So wonderful. So, Mary Ellen, thank you so much for having us learn more about health coaching today, and how it all works when someone works with you. It's wonderful.
Thank you so much for having me.
My pleasure.